Respiratory motion management is a necessary element in the treatment of abdominal tumors. The motion changes the tumor's location, and the treatment strategy needs to account for this. In radiation therapy, a common approach involves increasing the tumor treatment margin, exposing healthy tissues to radiation. In percutaneous procedures, such as tumor ablation, motion management is achieved by inserting a needle during a patient's breath hold. This solution is not suitable for all patients and leads to longer procedure times. To avoid excessive radiation exposure or prolonged treatments, accurate real-time localization and delineation are essential during the treatment of abdominal tumors. Imaging modalities, such as computed tomography, magnetic resonance, or ultrasound, are frequently used during abdominal interventions. Magnetic resonance is particularly advantageous in abdominal procedures because it is radiation-free and provides enhanced soft tissue contrast compared to other modalities. However, there are some disadvantages associated with magnetic resonance imaging, such as the relatively low acquisition speed, and it can be ergonomically challenging and uncomfortable for clinicians. In this study, we propose the implementation of conditional generative adversarial networks to generate abdominal magnetic resonance scans. The network is conditioned by the surrogate signal derived from tracking the external abdominal motion. The generator is trained to generate magnetic resonance scans, using image pairs which correspond to medical images and their corresponding abdominal surface displacements. A point of the receiver coil used during image acquisition was tracked, enabling the conditioning of the scans to the abdominal displacement. We also investigated how different window sizes in the input signal can affect the image quality and motion profiles of the generated images. 4 models were trained using a concatenated vector as input that included the current observation and past observations. Different weights were applied depending on their proximity to the current observation. These models are referred to as single, short, medium, and long retention. During inference, the trained generator can produce dynamic scannerless magnetic resonance scans based on the current abdominal displacement. The external motion enables the generation of dynamic images based on the current breathing state. 7 healthy human subjects participated in this study. The abdominal motion was extracted by tracking the motion of a white marker in the receiver coil. All subjects signed a consent form and repeated the experiment 3 times. In each session, participants were asked to perform 3 breathing patterns: deep, regular, and shallow. Each pattern had a duration of 3 minutes. The evaluation process consisted in assessing the results of the 4 proposed models, performing an objective analysis. Different performance metrics were applied to assess image quality and the accuracy of the respiratory-induced motion observed in consecutive generated scans. The objective analysis showed that image and motion quality increased if the conditioning included past observations. The similarity map indicated that values below 0.7 are mainly concentrated in the regions of the lungs and liver. The highest structural similarity and signal-to-noise ratio were obtained for the results of the long retention model. Additionally, the similarity index was computed for different window sizes, and it was observed that the overall image is well defined. However, lower values were obtained for low window sizes, indicating that details might be less accurately defined. The generative model was tested for different breathing modes, and the motion was evaluated for the superior, inferior, and anterior-posterior directions of motion. The mean absolute error, peak to trough distance error, and coefficient of determination were calculated for each model. The results for the superior-inferior direction display that the long retention model outperformed the other models. As part of the evaluation, we performed a subjective study which included a questionnaire-based evaluation which was completed by clinical experts. A total of 32 experts participated in the subjective study, and 20 of them were trained radiologists. The average years of experience among participants was approximately 12 years, and it took approximately 12 minutes to complete the questionnaire. The questionnaire consisted of 4 tasks. In the first and second tasks, a set of 6 scans and dynamic sequences were presented to the participants. The task involved indicating whether the image or sequence was real or fake. From the 6 images and sequences, 2 were real and 4 were generated by the network. The third and fourth tasks included 6 pairs of images and sequences. In this case, participants had to indicate the real image or real sequence from the pair. For all tasks, participants had the option to not answer by selecting the option I am not sure. The results of the questionnaire indicated that for all tasks, except for task 2, more than 50% of the fake images or videos were classified as real. To conclude, this study presents the implementation of conditional generative adversarial networks to generate dynamic abdominal scans based on the external abdominal motion. The advantages of using such surrogate is that the sensor is non-contact, radiation-free, and inexpensive. Additionally, experimental validation was achieved through a clinical study with human subjects, and the generator was generalized to account for breathing variability. The objective analysis showed that image and motion quality increased if the conditioning included past observations. Additionally, 32 clinical experts participated in the subjective analysis, and more than 50% of the fake images and videos were classified as real, except in one task of the questionnaire. Finally, scannerless magnetic resonance imaging can support clinicians during abdominal treatments and reduce time and radiation exposure. The proposed framework can be extended to include the registration of scannerless images with intraoperative data, such as images or surgical tools, and to model additional sources of motion, such as the heartbeat. Thank you.